Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Procedure and the radiation associated with the procedure. For X-ray abdomen, almost zero point 0.7 millisieverts radiation exposure is there, whereas for intravenous urograms, there is 2.5 intravenous urogram 2.5 millisievert exposure is seen. Whereas for micturating cystourethropy, you can see that there is 1.2 millisieverts of exposure will be seen. So these are the different investigations and these are the exposure. So what is important in all this is actually which has the highest exposure. The highest exposure is for almost renal angiogram. It is around 30 millisieverts is the maximum dose of exposure. So this is one thing. And the least exposure. The least exposure is for X-ray abdomen has the least exposure.
thank you and thank you for watching.